Hello, everyone. Welcome to the podcast, the show where we highlight the success stories of business owners and professionals. I'm your host, Andre Wright, the owner of Wright Consult Digital Marketing. Today, we have Hal Schlenger, the healthcare strategist, with us on the show. So I just want to say I've known Hal for a while, and he's a super connector and very knowledgeable and experienced person in his field. Hal, welcome.
Morning, Andre. Thanks for having me.
It's a pleasure. It's a pleasure, sir. So, Hal, I want you to tell our audience about your background and how you got into the healthcare business.
Sure. Let's start with the fact that the healthcare system is broken. I think most people, if you ask, the healthcare system is broken, and I personally love things that are disruptive. Which the system's broken. I found from listening to my wife, who's a nurse practitioner, so she's involved in generating revenue, how broken the system is. And since I love disruptive things, I found solutions that are several years old, but not 20 years old. They're in the last 5, 7 years, 10 years, and people don't know about them. So for me, I'm able to bring ideas to people that solve the problem of the broken healthcare system.
So you mentioned it's broken, but for some of our listeners or someone who's watching, you're like, I'm fine. Over these years, I'm okay with my healthcare. It's not broken for me. So I wanted to quickly point out some of the deficiencies of the system.
One, how much do things cost? My guess is if I ask you how much your doctor gets paid for that visit, you don't know. Women don't know what a mammogram costs. You're out playing sports and you hurt your shoulder or your knee. What does an MRI cost? What does an orthopedist cost for both a visit and surgery? People don't know. So how can you be a consumer? So that's one problem. Second, your doctor gets paid when you're sick. You, on the other hand, don't want to be sick. Wouldn't you rather pay somebody as long as you're healthy? And if you're sick, they just have to give you unlimited care until you're healthy, right? That's lining up what I want to pay for is to be healthy and not wait until I'm sick. So right now, doctors are paid for you to be sick. And anyway, so there's a couple of examples of how broken it is. Oh, by the way, health insurance premiums, right? They keep going up. Blue Cross and United Healthcare have made more money than in the history of their company, more profit in the last year. And if you think about it, the GDP in the US, healthcare is 18%. So almost $1 out of $5 is spent on healthcare. That's the highest in the world. I mean, that's just so much higher than every place else in the world. So it's broken.
You touched on something about the whole cost and the premium, keeps going up. So what's the driving force behind that?
What's shooting the cost are a couple of things. One is there's no price transparency, so you can't shop and you're discouraged. In fact, I often ask my clients as we get started, because it's always a matter of can we get along and help each other, is for me to say, who pays your doctor? You wake up sometime and you don't feel well, something hurts, you have an accident. Who's going to pay the doctor? Who's paying the urgent care center? The answer is the insurance company, not you. So, I mean, again, it's another example of it being broken, that you don't know what things cost. So when you say, why are the premiums going up so much? It's because the insurance companies are covering the costs and everybody else is raising their rates because nobody's saying enough is enough. Well, I don't want to say nobody. I do want to say that my clients, I can show you clients that have seen a decrease. I'm dealing with one client today where they're having to decide, do they want a 4% or a 12% decrease in their premium? Because we have two different options in front of them. Do they want a 4 or 12% decrease? So the reason it's going up is people are complacent, or they don't know there's a solution, or they simply say that's all there is and they don't even want to try. They accept it.
Wow. There are a lot of issues around healthcare, and even you can look at our government. I mean, it's so hard to come to a consensus on the best healthcare plan, right? So it's a I know it's a tough situation, and there are a lot of moving parts, and there are different dynamics to it. But I'm so excited for you and your company and what you're trying to do, because obviously there's a problem.
And tell you that I have story after story after story of solving it. Like one guy changed to what I'm offering, saw his premiums drop by 15%, and then had to have a test related to his heart health, his health heart. And I got a note from him. He said, it cost me $600. 2 years ago, under the other plan, it cost him $1,800 out of pocket. So not only so my point is that when you say, people, try, it already exists. So you ask, what do I do? What is my service like?
Yeah.
What I do, what I'm trying to do is help employers attract and retain employees. That's what I'm here for. I'm not here to sell insurance. I'm not here for any other reason other than to help small and mid-sized businesses attract and retain employees. And that's because if you find somebody like any of us, if you're looking at a job, you're going to say, what do I, can I do it? And what do I get paid? But more and more people are looking at the total package and not the salary or the hourly wage. They're looking at the total compensation.
That's true.
People are winning. I'm working with a company that's a truck driving company. And they said people get paid by the mile, and they're realizing that they have to put health insurance on as the differentiator, so they're not getting into a fight over a 1 penny a mile difference. So to attract and retain employees, employee benefits are the most requested, and health insurance being 80% of the cost of employee benefits. That's what I do. And I took it, I had plenty of experience in enterprise, large companies. And I realized though that small companies like Andre, like yours, small companies are more accountable, more innovative, more passionate about helping customers, that I want to do my part to help small businesses succeed. So for Andre, for your business, and for law firms and medical practices and other businesses that are generally small practices, small businesses, I want to help them attract and retain their best employees.
Fantastic.
What to do by offering health insurance.
No, definitely. And we all need that. You're taking on a new client. I wanted to walk us through the process, or your process.
Oh, okay, sure. So somebody says, I've had enough. Enough is enough. I'm mad as hell, like the old movie said. I want to find out that there's an option. So what we do is we'll have an initial consultation to make sure we understand what you need, what you want, right? Because health insurance can be $100 per employee. It can be literally $1,000 per employee. And it can be $2,000 for a family if you're not careful. So first we got to figure out, what are you trying to do? What can you afford? Not what do you want to buy, but what can you afford? What's your competition doing? So let's do somewhat of an analysis and evaluation of your current conditions. And if you say, yeah, this can work out, the next step is simply to gather a list, a census of your employees. And we start working from there to say, are you full of young people, old people? And it's just getting into who's who and who needs what.
Yeah, and that's a clear enough process, and straightforward. And again, listeners, Hal is a consummate professional, and I've spoken with Hal many of times, and he's the real deal. So Hal, we're in the greatest pandemic of all time, and it's a kind of a tricky period. How has this pandemic impacted your business and also your clients?
The pandemic has been, dare I say, a good thing. I refer to the pandemic as the great accelerator, in that things that were going to happen happened a lot faster. And in that, first, right now, this is an example of one thing that's helped my business, which is that we're doing more video calls. More video calls mean I have a lot better conversation with you than if it was a phone call. I will still with people in person, we'll do it safely. However, a phone call was far less connective, and I wasn't doing screen sharing and such. So the first thing for me is that it's helped have video calls, where I've been trying to do video calls for years and people ran away from them. So that's one. And then for my clients, and this is helping my clients financially as much as it is for healthcare, and that is telemedicine or telehealth. Um, the reports are that, and I had a really good experience, really good conversation, presentation with Wellstar, that something like 6 to 8% of the doctors were doing telemedicine before the pandemic, and now it's 80%. And we believe that after the pandemic, it'll swing back to 40-ish% of the visits will be by telehealth. The benefit, and I'll say this first financially, this is great for my clients. It is less expensive and it is better access to do telehealth than to wait a week to see if something goes away. So better access, quicker access, less expensive access is telehealth. And then the long term is a lot of the follow-up visits. If I need a follow-up visit, why do I want to drive to your office, sit in a waiting room with another with a sick person, just so you can check on me? It's amazing how much telehealth can do. In fact, the Wellstar presentation, these guys are really good. We're saying that 80% of your doctor visit is just you and me talking. It's considered getting the history of the present illness. And you describe the things that happen, and doctors are really good at asking follow-up questions to determine, is it this or that and this and that? No different than when you're doing your marketing. And they can do that. And it's interesting because they'll tell you that 80% of the diagnosis is done just by listening and talking and looking. And then the other 20% might be done in person. Really, that's only to validate what they think is the problem. So they're diagnosing without touching you. And then they're going to do tests, whether it's testing or stethoscope or blood test, which is in person.
No, and these are great points, Hal, because even for some of my clients, as you know, I work in the healthcare space. Doctors are pushing telehealth now because we've seen the statistics that you mentioned. So we're doing a lot of digital marketing programs towards that, because we know.
Yeah.
I mean, and one key thing out of what you were discussing in terms of the video call and not be able to meet face to face is convenience. It's just convenience. Because I mean, I could just wake up, you just get up and just jump on my computer and speak to my doctor, and then get it done and then get my day going instead of have to jump in my car and drive to go to the office. So convenience is a big thing, and I'm so glad that you touch on those points, because those are effective points, are important points even for my business.
And I've been to a Step Ahead physical therapy in Roswell, and they started doing physical therapy remotely.
Mm.
And I think the doctors will tell you, remote is not as good. I get that, no argument here. But if the patient isn't going to see you because of convenience, or they don't have transportation, or a senior person where it's going to be more detrimental to go out in the bad weather, and the risk of slipping could be more detrimental than staying home, then then I think some of the doctors are actually missing out on appointments that we can get done through telemedicine. Yep.
No, awesome. So basically, what this does, as you so eloquently pointed out, this actually increases business for these healthcare practitioners, because they can see more patients in a short period of time. So I know this pandemic has impacted a lot of people, but there are many positives, and you definitely highlighted that. But yeah. Hal, I know we're kind of strapped for time, but you mentioned on the outset about the broken healthcare system, right? But I want you to talk to us about how has healthcare the industry has changed.
I would say the way it's changed is simply that there's so much money in healthcare that you're seeing things like private equity or consolidation happening, meaning somebody wants to come in and find a way to take those profits or make more profits. So you see a lot of doctors' offices that have sold to hospital systems or other organizations, and all that does is get people more focused on money than on the care. So there's a group of doctors in Atlanta called Hip Nation that have actually gotten out of the system and said that they're doing what is referred to as direct primary care. It's an example of getting away from the insurance companies, which is where all the money is coming in for these companies that are consolidating. Is they're saying, wow, look how much the money the insurance company is paying. I don't mind fighting for and negotiating to get good deals with the insurance companies, but wow, there's a lot of money there. So that's the problem, is that the insurance companies are being asked to do something. I don't want to say the insurance companies are wrong. They're not wrong. They're not doing anything wrong. They're doing what any business would do, and they're doing it very well. We just need to be able to say, let's change how we engage with our healthcare system, and then we can engage with the insurance company differently. So when you said, why is it broken? Because there's so much money involved. One out of every $5 in the US is somewhere in healthcare. So if you were looking to invest into a business, right, if you're private equity, or if you're already in the healthcare system and you want to grow, what are you going to do? Consolidate.
Yeah, yeah. And how, great points. And, you have touched on some things that we know that are out there, and even the healthcare system overall. There are a lot of issues. And as we discuss, I mean, I don't know when, there are a lot of moving parts.
Yeah.
A lot of moving parts.
It's great that you say that, because you've got the doctor, the patient, the billing company, the insurance company. You got federal laws and such. There's lots of pieces that are all connected.
Yep.
So there's no single, silver bullet. There's no single answer. And that's where somebody like me can come in and show you which pieces will benefit you and your employees, so you're attracting, retaining good employees. You're right. It's not a simple solution.
Right. So how you don't actually, so your main focus then as your business is really to engage with employers and help them with the solution for their employees. So you don't work directly with, say, just a financial advisor, a person just doing his thing by himself, a solopreneur.
I do. I continue to support and write policies for individuals. Absolutely. Because and we were talking about this earlier, that it's all who you know and how you help each other, and we all have to trust each other. So I'm happy helping individuals, because they end up introducing me to businesses as well. So it's a little ecosystem.
Right, right. And how, again, we're running down, but I want you to tell us some of the best practices to maintaining, from an employer perspective, like a good premium. What are the key things you should do right now as an employer?
Besides talk to me.
Besides talking to you.
Things like sharing the health history of the employees, so that we can underwrite better, is one. Encourage your employees to get engaged with their healthcare. Don't think that I just have this card, I'm going to walk into the emergency room, get taken care of. Talk to people like me that will show you how some of the hacks, how to hack the system and stay healthier, or don't spend as much money. We talked about telehealth as an example. Don't wait for care. There are some doctors who, and I'm not criticizing the doctors, but they're paid by the insurance companies. So they're having to do what the insurance companies want. But some of us don't believe that there's a pill for every ill, right? That's kind of a joke of, you see a doctor, they give you a prescription and you're all better. Like, no, that's a short answer. So to answer your question about how to lower your premiums, it's get engaged. Get engaged with your broker, get engaged with your doctors, get engaged with somebody who can give you some advice on how to lower your costs. And as soon as you ask, I mean, I asked my surgeon, I had a hernia a couple years ago, and I was actually told, go to Dr. Hoadley and ask him for the cash price. And I'm thinking, wait a minute, I can't negotiate prices. This guy's going to cut me open. After he anesthetizes me, which I can die from, he's going to cut me. I can't ask him for a discount or something.
Yeah.
Doctors welcome the conversation of how to keep your costs down. I mean, there are so many good doctors and the hospitals in town. There are so many providers in town that are good. We just have to ask. And that's why I'm saying, let's get engaged.
Those are great points, Hal, and thank you so much for enlightening us today. And before we go, Hal, I want if you could tell us one thing that you can invest in, whether professional or personal, what would that be?
I think professionally, because this is you're talking to businesses. Professionally, I want to do more follow up. I want to be more engaged with my clients, my prospects, to help them. I know that we all get busy, and I'm not the first person on their list for things. So I just want to make sure that I can stay engaged with people. My clients, I get calls out of the blue sometimes because they saved my newsletter or they saved something and said, I meant to. So to me, that's it. I'd like to go deeper and stronger with my relationships.
Great. That's a great answer. And how, for our listeners, how can we reach you?
Well, I would tell you could find me on LinkedIn, but spelling my last name Schlenger is often hard for almost everybody. So the agency is Great South Benefits. So greatsouthbenefits.com is the website. And you can either find me at Great South Benefits or try to spell Schlenger and you'll find me.
Fantastic. And Hal, it has been great, my friend. I know we learned a lot, and we know it's a broken system, and you and your company put out some great strategies to how to fix it, and also we know it's dynamic and there are a lot of moving parts, but hopefully one day we'll get it right.
We've got it right. We've got it right, and you and I are going to keep talking because we're going to find some more ways to help others with this, like we're doing now.
Of course, my friend. Thank you so much, and we'll talk soon.
Thanks, Andre.